Thank you, everyone. Good afternoon. And today, this is the last session, so I'll give a brief lecture for the role of the evidence of phytotherapy for the BPH. The phytotherapy is the use of plants or plant extraction for medical uses. On the urologic field, the phytotherapy for BPH, the majority is used supplemental, which name is Serenoa repens. It lives in the Florida region, and the leaf is like a saw-like leaf. It lives over 700 years, so it is very long life. Including the American country and the European country, and also for Korean domestic country, there is such a many supplemental thermal repens products. The major component it concludes the fatty acid, methyl ethyl esters, and glycerides. The major mechanism of the thermal repens includes the anti-androgenic effect by the inhibition of 5-alpha reductase, including the lauric acid, and had a pro-apoptotic effect and has an anti-inflammatory effect. So these, in fact, could make a beneficial impact also in the chronic prostatitis as well. So therefore, we could prevent and treatment the BPH patients. The other additional effects include the inhibition of the alpha receptor binding and increasing of the testosterone or libido, and some prevention of hair losses as well. There is a bioactive components of supplemental extracts. The major component of the supplemental includes the free fatty acids, and this is the major component to make effectiveness to treat the BPH patients. So the free fatty acids, such as lauric acid, is very important, and the permixin has over 80.7% of the free fatty acid, and there's a various portion of the free fatty acid portion, and there's other components such as methyl ethyl ester and glycerols as well. And also the extraction type on Serenoa repens is very important to make a supplemental. There's about 3 types of extraction. There's a hexane extraction, ethanolytic extraction, and also for supercritical CO2 extraction. But the most important extraction method is hexane extraction. Early on the 2006, there was on the American study on the New England Journal of Medicine, there was a double-blind RCT study including 225 men who had a moderate to severe BPH symptoms for 1-year treatment with supplemental and the placebo treatment. However, there was no significant difference between the supplemental and placebo groups in terms of the IPSS score, Qmax, residual volume, and quality of life as well. And overall, on the 2011, which published on the JAMA journal, the authors had increased the dosage. The standard dosage is about 320 milligrams, but they get up to 3 times to standard dose by the multicenter placebo control RCT study. Also did not decrease the urinary tract symptoms compared to the placebo medication. After all, the several RCT study and prospective observation study has accumulated. On 2016, on the European Urology, had made a meta-analysis including 12 randomized controlled trials to investigate the efficacy and safety of hexanic extraction of serum repens for treatment of LUTCH. And comparing the permixin and placebo, there was a significant improvement for the Doc-Tria level and Qmax level. And interestingly, comparing the tamsulosin, the alpha blocker, and permixin, there for the IPSS level and Qmax level, there was a little bit favorable for the tamsulosin on the forest plot, but that had no significant difference, so we concluded that it was similar between tamsulosin and permixin therapy. But the included studies into the forest plot is very few, just 2 studies, so it is questionable. And one more forest plot, adding the permixin to the tamsulosin, the additional booster study, had an impact also in the IPSS score, lowering about 0.31. So the author concluded the permixin had a relieving urinary symptoms and urinary floor compared to the placebo, and had quite a similar impact comparing to the tamsulosin, and had a very limited sexual function. After all, on the 2018, some other authors have concluded the meta-analysis, including also the RCT and the prospective observation studies. So the result was similar between the 2016 European Urology result. Comparing with the permixin and the placebo, there was a significant impact on the Doc-Tria level, Qmax. Doc-Tria has been decreased about 0.6. Qmax has been elevated about 2.75. It had a significant effect. And for comparing the permixin between alpha blockers, IPSS score Qmax did not have a significant difference, but it had a little bit favorable to the alpha blockers. An additional study between permixin and 5-ARI, IPSS score has been similar to the permixin therapy. So the author concluded that the permixin reduced Doc-Tria and improved Qmax compared with the placebo, and have a similar efficacy to tamsulosin to relieve the lower urinary tract symptoms. So finally, on 2021, European Urology Focus has reported the network meta-analysis, including randomized control studies, to investigate the clinical efficacy of serum S repens versus placebo versus alpha blockers for the treatment of LUTCH symptoms. This analysis had some sub-analysis, including the treatment duration and the type of the extraction. So even if the alpha blocker treatment had a great impact on the short-term treatment for 3 months, and the supplemental treatment had just a little bit on the 3 months treatment, but it had increased at the 12 months. 1 year treatment has been increased dramatically. And considering the extraction type, when we use the 1 year treatment, the hexanic extraction had a benefit compared to the non-hexanic extraction. For the Qmax evaluation, everything was similar with the IPSS without the extraction technique. Extraction from hexanic or non-hexanic did not have a better impact on the Qmax evaluation. So for the summary, the short-term follow-up, there was no significant improvement in the IPSS or peak floor of S repens treated with comparing with the placebo and alpha blockers. Only the long-term, such as 12 months medical treatment, had a benefits of S repens. And also for comparing the hexanic S repens, had a greater improvement compared to the non-hexanic in terms of the IPSS level. Both supplemental extract showed a low value compared to the all blockers impact. And so for the conclusion, initially there was a non-impact from the New England Journal of Medicine of supplemental, but after all, the accumulation of the RCC study and several observation studies, the meta-analysis had revealed the beneficial impact of the supplemental. However, only a long-term treatment only benefits in the treatment of the men with large BPH. So for the authors and my opinion, the patient who want to avoid side effects such as hypotension or loss of libido or ejaculatory disorder, and who do not need such a rapid efficacy, and who can pay for a cost for a long term, certain repens could have a rationale to treat the BPH patients. So that's it. Thank you for listening.